Today, Penn State Health and Mid Penn Bank are here to celebrate 10 years of making a difference with No Shave November. For a decade, they have teamed up to raise awareness and funds for men's health, supporting research, screenings, education, and survivorship for prostate cancer and other urologic conditions. Today, you'll meet patients, hear from the experts, and find out how you can donate and help them with their mission. Good morning. Thanks for being with us. It is a Good Day PA. I'm Amy Kem. On this 10-year No Shave November anniversary, Penn State Health is here to remind us of the importance of screenings for prostate cancer, a screening that can save your life. Deborah Pinkerton joins us with more.
Statistics show a man is diagnosed with prostate cancer every 2 minutes. A Lebanon County man never expected to be part of that statistic. Jim Jones shares his journey.
Your seat this year. You're our big winner. Congratulations. Have fun. We look forward to seeing you in the playoffs.
A familiar face and voice of the Hershey Bears, Jim Jones, better known as Jonesy.
In hockey, everybody's got a nickname. So if you go to the rink or you'll hear it, let's go down to Jonesy on the ice, or Jonesy, what's going on?
A nickname that's been around since the 1990s when Jim got involved with game night entertainment during the Hershey Bears games.
It's kind of morphed into a different role now where interviewing players, interviewing coaches, being part of the broadcast team on game nights in the third period, being one of the analysts between the benches in the third and getting to call the action with Zach Fish and Mitch Lamoureux.
Jim has been with the Bears when they captured 5 Calder Cups, including the latest one in 2024. While the Bears won the title, Jim had his own personal health battle to defeat. Help came from doctors he knew both on and off the ice.
Matt Silvas is my primary care physician, and he is also the Bears head physician as well, and part of our medical staff. And Matt is also a good friend of mine.
For adult men over the age of 50, or some people say 55, we recommend prostate cancer screening. And there's a blood test that you can get called a PSA.
I had a prostate exam every year, and he saw something that he thought was a little abnormal. We kind of went back and checked it a few months later. It looked a little bit more abnormal, so we win the cup. And his recommendation was to go and contact Dr. J. Raman, who is the head of urology here.
I know Dr. Raman well. We all work here at Penn State Health and work collaboratively. So I contacted Dr. Raman immediately after detecting the elevated prostate blood test for Jim.
Jay and I met in April, and we kind of had a consult where I had an exam, and he wasn't sure, but to be safe, for my safety and my wife's, we did an MRI at Penn State in Lancaster. There was a small shadow. Just to be safe, he wanted to do a guided biopsy.
We always ask, do you need to have a biopsy? And his story fit together. His numbers were going up. The MRI showed some areas. So I said to him, look, I think you really need to have a biopsy. I don't know if this is prostate cancer, but this will help us find out.
We did the biopsy, and he was on his way to Peru. And he said to me, I'll get a hold of you in a week. I don't think it's much, and we'll take it from there. He called me 2 days later and said, I'm shocked to tell you, but you have prostate cancer.
I sort of looked at my charts and I saw his results, and he had been diagnosed with a more high grade and type of prostate cancer, multiple areas in the prostate, more aggressive.
It takes your breath away when you hear that, because there's no history in my family at all.
I don't love to always just give people news over the phone, but even a quick call to say, look, here's what I saw, this is the plan. When I get back, I'll see you. And I think at least goes a long way in just, comforting people for that 1 or 2 weeks until the next step.
The next step was a prostate cancer specific PET scan.
This really showed, thankfully, that there were areas in the prostate that were lighting up, but not elsewhere. And that really gave us confidence of saying, look, this is localized disease. So Jim, you have the type of prostate cancer. It is a more aggressive type of prostate cancer, but it hasn't spread. So we have a window here of cure.
My decision, along with my wife's, was to go for the surgery. It seemed very early in the journey, and on November 11th of last year, I had my prostate cancer surgery right here.
The surgery is called robotic surgery. So we're basically doing minimally invasive surgery, but we're using a robotic platform. So the great thing about robotic platforms is 3D visualization. And you can really manipulate the instruments much like you're manipulating your fingers, and bring a camera maybe about an inch away from your target. So visualization is great, precision is great, blood loss is lower.
So I was diagnosed with prostate cancer early this summer.
2.5 weeks after the surgery, Jim was back on the ice for the annual Hockey Fights Cancer event to share his journey.
It was a little hard to get through, but it was nice to be able to say, look at me, I had cancer, I took care of it, I'm standing here, you can do this as well, but pay attention.
I hate to use the word poster child, but he is a poster child of why men should get screened for prostate cancer.
I feel fantastic, and I feel like it's a gift. Life is a gift, and I have a feeling that I was given an extra card in the deck to play, and I'm going to use every bit of it.
Jim now uses his famous voice to urge other men to talk with their family providers and get their PSA checked.
Well, thank you to Deborah. Joining us is Dr. J. Raman, Chair of the Department of Urology at Penn State Health, and Rory Ritrievi, President and CEO of Mid Penn Health. We are back again to talk about a no-shave November. It's been 10 years. We just heard a wonderful story, an incredibly moving story about one of your prostate cancer patients. And after hearing stories like that, how does it feel to see the impact of this campaign for 10 years now, really encouraging men to take control of their health?
Yeah, I mean, I think that's what it's all about. I think Jonesy's story sort of epitomizes what we think about with No Shave November, which is, we want to engage with guys. We want to reach out. We want to educate them. We want to empower them to actually take control of their health. And that really starts with getting in with their primary care providers, getting their health maintenance, getting their screenings. I always say we've so much stuff that's changed in 10 to 15 years in medicine, but we can only impact people if they make it in the door. And so that's the message, is get in the door and get checked.
That's a really good point. That's really what it comes down to, doesn't it? And Rory, Mid Penn Bank has been involved with this for 10 years, really a driving force. And looking back, what does this milestone mean for you, for your entire team?
Well, so the 10th anniversary is tin and aluminum, which are symbolic of strength and durability, but also flexibility.
That's
and I
so
think
cool.
that's the thing that I take the most amount of pride in, because you've got two big organizations who have found a way to partner up and create some real magic over the time. And I think that took a lot of strength and durability and certainly some flexibility.
This started, Dr. Raman, just as a fun way to grow money, grow beards, and it all came together. But it has taken off, and the awareness it's brought to men's health is phenomenal. Can you talk more about the evolution of No Shave November?
Yeah, I mean, I think it's a really fun month. I think that's why it keeps going. I mean, we have really a good relationship. It's a fun riff. I think that we have a really good time with it. But I think that more than anything else, the message and the reason we raise the money is a really important one. And I think that's sort of the theme is, help research, help get clinical trials off the ground, help with survivorship, grow that network, build a community for patients that are cancer survivors, more screenings. And to me, all the money we raise, the importance of it is it funds these efforts. And that's, the fun part is fun, but the message is a serious one.
Well, yeah, but it's the perfect package. It's the complete package, really. And Rory, Dr. Raman mentioned that friendly little riff that you have. You have a competition on who can raise the most money, who can grow the longest beard. Talk about the secret to getting those donations really coming in.
Yeah, Amy, I think it really gets down to making sure that it's a lot of fun. Right, because people are calling their friends and they're calling their family and they're asking for donations. So we want to put a lot of fun things around it. So we have kickoff parties, we have mid-month parties, we have a 5K this year,
5K, yeah.
Dash for the Stash. So I think the key to it is just make it fun.
Dash for the Stash. That's a brilliant name. I love it. See, it's keeping it fun. It's keeping it fun. Thank you so much, guys. We're going to talk to you both again in a little bit. If you would like to donate to the No Shave November campaign, scan the QR code now right there on your screen. Well, coming up next, we'll hear about this year's No Shave November fundraising goal and how you can get involved. Stay with us. We'll be right back. Welcome back. Joining us again is Dr. J. Raman and Rory Ritrievi. Dr. Raman, over the years, your patients have really gotten involved. They've shared their stories. They've rallied around the cause. They have donated. Yeah. So for you, what is that like to watch that come full circle?
Yeah, I mean, I would say in the month of fundraising, the majority of what I'm able to raise is just through the generosity of patients and their families. And I think it's one of the great things about our community, and honestly being a physician in the community, is that the patients are paying it forward. And I think they're donating because they know the money goes to their neighbors, their friends, their family members. And I would certainly say without their help, I wouldn't remotely come close to being able to hit some of the numbers I've been able to raise. And I think our efforts wouldn't get to where they needed to get to.
Yeah, and turning to Mid Penn's efforts, just an incredible partner over the years. And you really get your employees involved. How are you able to really motivate them and other community partners to take part in this?
Yeah, so our employees are very community oriented. They've always been. We have a lot more of them today than we did back in the beginning. We're over 800 employees now. So they're all, we're motivating them to do it. They dress down, they contribute money, get the dress down throughout the month of November. And then they contact a lot of their customers and create these community partners. So I think we have 16 community partners this year. Some of them are repeats from previous years, but some of them are new. And so that's how our employees do it. They contribute their own money, they ask friends and family to contribute money, and they help with the community partners.
It's terrific. I love it. Again, 10 years. So I know the goal started like this 10 years ago, and it's grown to like this. So what is this milestone year goal, and how are you going to reach it?
So it's usually me with a big mouth saying what the goal is, but at our kickoff party, Dr. Raman answered the question that someone threw out, and so he said,
well, I mean, the last 2 years, we've done an amazing number, 340,000. And I said it's the 10-year, so I think we want to
10
eclipse.
million.
Well, hope springs eternal, right? So I said 350,000, which would bring our 10-year total.
660-ish, yeah. Somewhere in that neighborhood.
Okay. We got to get it going then. Folks, you need to donate. And all the funds raised, that goes towards screening and education and survivorship programs. So tell me about how these dollars are really directly helping men and their families here in our community.
Yeah, I think it's a great question because it's not a matter of just raising the money. I mean, if you raise the money and you don't do anything with it, then what are you doing?
Sure.
And so I always say, I think there are 4 pillars for No Shave November. One is research and clinical trials, growing that. The second is survivorship. And I think it's not just survivorship for patients treated at Penn State. I say any prostate cancer survivor is welcome. The third is screenings, more places, more times of the year. And the last is education. So, I mean, residents, medical students, trainees, I think it's important that they be part of this because, long after I'm done practicing, the message is the same and somebody's got to carry that forward.
Right, and keep it all going forward in terms of treatment and options and the awareness. Yeah, we got to keep it going. Like you said, people need to know in order to get screened and know what's going on. So thank you. Good to have you. You guys will be back later in the show, I know. Throughout the show, they'll be here. If you would like to donate to the No Shave November campaign, scan the QR code on your screen. We will be right back. Welcome back. No Shave November raised an amazing $340,000 last year. That money is being used to pay for free screening clinics, research, and raising awareness about prostate cancer. Now, Penn State Health is excited to expand prostate cancer survivor support sessions. Donna Kirker-Morgan joins us with more. Hi, Donna.
Hi, Amy. Many prostate cancer survivors donate to No Shave November every year. And now those dollars help those same patients thrive and survive. Recently, I met a couple of prostate cancer survivors who are very glad the support group sessions are expanding thanks to No Shave November. Navy veteran Craig Herrick traveled the world in service to our country.
Spent 30 years wandering the globe and ended up in central Pennsylvania.
Joe Herman has spent his life serving children in Lancaster County, first as a teacher and now as a track and soccer coach at Penn Manor High School.
I coach, I used to teach and spent 39 and a half years in the classroom.
Very different lives, but now on unexpected yet similar journeys through prostate cancer.
It's scary. I mean, the word cancer is something that immediately brings about dread. Numbing. It just totally numbs you.
Both turned to the urology team at Penn State Health. Robotic prostatectomy and radiation were the medical answers, but there were so many more questions about moving forward after treatment.
It's a sensitive topic. I mean, breast cancer, prostate cancer, colon cancer. I mean, those are kind of all areas that we don't tend to want to talk about in public, and yet it's important to.
Penn State Health's chair of the Department of Urology, Dr. Raman, understands how very important it is for cancer survivors to share common experiences. So he was determined to expand the Prostate Cancer Survivorship Support Group with funds raised during No Shave November.
A lot of men, a lot of families, and there's a big need for it. We said this is one of the priorities, is to get this back off the ground again.
I think it's real important. It takes away some of the anxiety, because you can sit down and talk with some of the folks that have survived it. It's less scary if you know somebody who's maybe a little farther down the journey, and maybe you can help somebody who's just recently, gone through it.
Each and every cancer has its unique challenges, and certainly with prostate cancer, that's true. Can affect men in ways that are so deeply personal.
Psychologist Dr. Michael Hayes says the Survivorship Support Group is just another example of how Penn State Health is not just treating the cancer, but is treating the whole person. These sessions are not just limited to Penn State Health patients, but are open to anyone who has found themselves on the unexpected prostate cancer journey.
You don't have to do it alone, and in many ways you can't do it alone.
I think, there's a lot of information we can gain from each other. I would say if you get a chance, try to come to this.
The support group meets several times a year now. If you're interested in finding out dates, times, or topics, call 717-265-8585.
Welcome back. Joining us now, Dr. Raman, chair of the Department of Urology at Penn State Health, and Dr. Michael Hayes. He is a psychologist and founding program director of the Care Center at Penn State Health. Dr. Raman, we talked about this a little bit earlier too. We like to show viewers where their donations are going. And something their donations have really been able to go to this past year is expanding survivorship programs. So talk about that.
Yeah, I think as Michael will speak about, survivorship for cancer patients is just absolutely so important. And the reality is, I think a lot of healthcare providers like myself, we endeavor to do better on that front, but we probably could do better. And it's hard in a 15 or 20-minute office visit to cover, I think, all the things that cancer patients need as part of their network. And so I'm really excited because we've taken some of the money from No Shave November. We've put it into growing our survivorship network, inviting great speakers like Michael to come and speak to patients. And I think really build a community and allow patients themselves to learn a little bit, but also to share maybe, what's been good and maybe what's not been so good in their journey. And I think that's the most important thing.
And let's talk just more about that. Dr. Hayes, again, you lead the Care Center at Penn State Health, and it does focus on the psychological and emotional effects of cancer, cancer survivorship. So what kinds of services and resources are available?
Delighted to have a chance to talk about that, Amy, but first let me thank you for throwing down the gauntlet. The $10 million donor is out there. We're just waiting for their call.
Maybe I overstepped a little bit there, but I got excited.
Aim high, and it's so incredibly important because these programs and services, fundamentally, most of them are not funded by private health insurance. And as a result, philanthropy is really the lifeblood, the life force that makes it possible. Through the Care Center, we offer a whole range of services from behavioral health, genetics counseling, registered dietitians, to a number of programs and services that aren't funded through philanthropy. Literally, the Care Center was built on a $1 million donor, Chris Milkey, who believed in what we're doing because she, as a cancer patient, understood the personal toll, the personal impact. Just this weekend, I was on retreat with a team. There were 15 of us from Penn State Health with a group of patients with advanced disease, including prostate cancer, and spent the weekend really, you have to be there, but transformational medicine happening there. We have a creative writing workshop. Jay and I were just talking about, we have an exercise medicine program. We're launching a food as medicine program. A whole host of things that really are meant to see the person and not just treat the disease. We also have programs and services, importantly, for the caregivers. Men don't go through prostate cancer alone. It affects all those folks who are connected with them.
Once treatment's over, that is not where the journey ends, right? And survivorship does bring that own set of challenges. Why is this support, ongoing support, just so critical? I mean, you've already sold me, but talk more about it.
Well, life comes with so many challenges, prostate cancer being one that nobody welcomes in. It's there. And each and every person has their own unique life experience, bringing them to that threshold. And then life beyond often is different. The complications of the treatment mean having to live life in a different way. And we'd like to imagine once the surgery is done, close the book, it's over. But men who've had this experience know that it's a part of their life each and every day. It affects their relationships with sexual side effects. And so survivorship becomes that lifelong journey. We want people to live a long, full life, to meet their goals, to achieve their dreams, to have meaningful quality, and support along the way is really central to making that happen.
And Dr. Raman, can you add anything more about just the importance of focusing on that emotional part of it?
Yeah, I mean, I think that what Michael said is really so true. There's all that we offer medically: surgery, radiation, chemotherapy, drug therapies. But I would argue that emotional health, mental health, physical health are just as important. And any of my patients will tell you when they're in my office, even if they're several years out, I leave them with 3 things at the end of the office visit. Did you get some exercise? Did you walk 20 to 30 minutes today? Are you eating reasonably? If you eat well for your heart, it's going to probably be good for the rest of your body. And did you spend 10 minutes just clearing your mind? Because I think the anxiety and the stress really plays a big role in how you do as a cancer patient.
And this is why I love this guy and being a part of the Penn State Health team. And I think, Amy, it's what really makes us unique, that we're not only treating the cancer, we're taking care of the whole person.
Yeah.
And that's special.
I'm really looking out for everybody. Thank you, guys. Really good to have you on the show. If you would like more information or make an appointment with the Penn State Health Urology team, call 717-265-8585. Welcome back. Men oftentimes put off going to the doctor. The Dauphin County man knew something wasn't right, and he immediately reached out to the Department of Urology at Penn State Health. Deborah Pinkerton spoke with Greg Alamon earlier.
Greg, thanks so much for being with us. Tell us, what symptoms were you experiencing that made you realize that something just wasn't right?
Well, I have been waking up 3-4 times every night to go to the bathroom. And then on one particular day, I noticed blood in my urine, and it was time to act.
So let's talk about your first appointment with Dr. Clark. What did he say was happening? What was causing this issue?
Well, he gave me a cystoscopy and noted that my prostate was enlarged, and it was pushing into my bladder, and it was blocking off my urinary flow.
And what was your reaction?
Well, I knew there was something wrong. There wasn't cancer, so that was good, actually. I mean, I knew I needed to have something done to repair it, but, there was actually some relief.
So Dr. Clark recommended Aquablation. How did he explain the procedure, and why did he say this was really the best option for you?
Well, he explained that it was a fairly new procedure, and it was a high-pressure jet stream that would cut the tissue that was blocking the urinary tract and allow a better flow.
So what did you decide to do?
Well, I asked him what he would do in that situation if it were his, and he suggested this and gave me literature. I read up on the literature and decided that would be the proper way to go.
So tell us about the Aquablation procedure. How was it, and how are you feeling now?
Well, the procedure itself, I was out for, but for the next week, I had a Foley catheter in me that I had to empty the urine and so forth and rest for a week. I took it out myself and became increasingly better each day. I felt better. And now I'm very happy with the procedure and what occurred.
So, Greg, really, what is your message to men who may be hesitating?
Well, I am one of those men who hesitates whenever there's something wrong, and I did certainly in this situation. But luckily for me, it worked out okay. My message is if you've got a problem, it's not going to get better on its own. You may aggravate, maybe get worse, get help.
And what is your message to men as far as reaching out to the urology team at Penn State Health? Why would you recommend that team?
Because it's a very confident, friendly group of people. They make you feel like they know what they're doing. They have confidence in what they're doing. And Dr. Clark in particular's bedside manner was excellent.
So glad that you're doing wonderful. You're feeling better. Thanks so much for sharing your journey with us.
Thank you.
If you would like more information or to make an appointment with the Penn State Health Urology team, call 717-265-8585. Welcome back. Joining us now, Dr. Joe Clark and Dr. Arturo Garcia Mora, urologic surgeons at Penn State Health. Dr. Clark, you are Greg's surgeon. We just heard his story. He underwent aquablation. So for those who are not familiar with this, including myself, what is aquablation? How does this work?
Aquablation is a newer procedure to treat BPH or an enlarged prostate. And it was FDA approved in 2017 to treat men with BPH symptoms, which include waking up at night to urinate, urinary urgency and frequency, and waking up or having a slowing of the urine stream. And so it uses a high pressure water jet to ablate the tissue. The way it actually works is under anesthesia, we place an ultrasound probe into the rectum so we can monitor the prostate in real time. And then we put in the Aquabeam system into the urethra, into the bladder, and on the monitor, we can program the machine to remove tissue from here to here, this deep, so we can tailor the amount of prostate tissue removed. And after everything's done, we press the pedal, and the robotically controlled system removes the prostate tissue using a water jet. The entire procedure takes about 10 minutes. And then after the procedure is done, we remove the system, and we have to put in a resectoscope to inspect the inside of the prostate. Oftentimes there's a layer of clot which we have to remove. There's some fluffy tissue and some ragged prostate tissue that we have to resect, and then we put in a catheter to let everything heal.
10 minutes. That's remarkable to me. And Dr. Garcia Mora, we talk a lot about prostate cancer today, but there are other conditions too that men are dealing with in terms of urologic conditions. What are some of those that you see?
Yes, there are. I'm in charge of the functional urology clinic, so I mainly see men with prostate cancer that had a complication and now have urinary incontinence from that. And we can offer several type of procedures for them. We can initially start with physical therapy, and that will help about 60% of patients. And for those who don't find enough relief with physical therapy, then we have surgical options that we can offer to them. We also take care of patients not related to prostate cancer, so men and women with different types of urinary incontinence, men with voiding problems because of BPH, because of several other issues. We take care of patients with bladder pain, with neurogenic bladder, patients with neurological issues that have problems with the urinary system. That's the things I mainly do in Penn State.
If you do need treatment, the surgical treatment you mentioned, what sort of options are available?
There are mainly three types of options we can use for men with post-prostatectomy incontinence. It's male slings, which is basically a small piece of mesh that we place beneath the urethra, and we compress the urethra in order to help with this incontinence. We can use a device called ProAct, which are two small balloons that compress the urethra near the bladder neck and create sort of like a new prostate to the patient, and will have some relief for urinary incontinence. And the gold standard of treatment we use is called an artificial urinary sphincter. That's a device that has been around for about 30, 40 years. That's a three-piece device that we compress the urethra. We have a pump that we can control the opening and closing of the device. Has about a 90% roughly success rate for patients. So it can really help patients recover their quality of life back.
Finally, what is your message to men who may be a little hesitant to want to even talk about the symptoms they're having, let alone go see a doctor about it?
I think we all will have changes with aging. I think we all will have consequences of the treatment we receive for different things. So I don't think there is any reason for you to be afraid ashamed or anything. It's just getting there, helping us, getting you better. You got your prostate cancer treated, that's amazing, and now we have to deal with whatever comes from that. So there are several things we can do. There is nothing to be embarrassed about. That's another medical condition as any other one can be, and we can just offer different things for it.
Very good. Appreciate you both being on the show today. Thank you.
Thank you very much.
We'll be right back. Welcome back. Joining us is Dr. Jaime Herrera Caceres, urologic oncologist at Penn State Health. Penn State Health continues to expand its urologic services on the West Shore. What does that mean for patients in our community?
So Penn State effort is to improve care for patients, right? And we're trying to improve our access, our waiting times, even commodity for some patients that live closer to our area, or even some more urgent cases in which it's hard to get them in Hershey sometimes. And we can do it, we can collaborate and do it in our center faster. We try to provide all those opportunities for patients to get what they need, right?
What we consistently hear from medical experts is screening, and it is so important in detecting prostate cancer. So why is it just so critical for men to stay on top of that?
Yes, very important. Prostate cancer is it's a condition in which early detection results in better outcomes, excellent curing rates, excellent survival. And we have a fairly easy way to do it with the PSA screening and the current screening programs. So I would heartily encourage everyone that is in that age range to consider that, or at least talk to their families about it.
And on that note, Penn State Health is offering free prostate cancer screenings. It's coming up on November 15th. Where will that be? What can men expect?
Yeah, so again, it's part of that effort that we do to provide care, and that's going to take place on the West Shore hospitals. That's going to be at the West Shore Clinic, that is by the Holy Spirit parking lot, if someone in the area is aware of it. And we're going to be there Saturday 15, November 15, to provide that care. So everyone interested, there's no cost, and we'll be happy to see everyone there.
We talked about the importance of the screenings for prostate, but overall it's so important to remind men, especially during this month, No Shave November, about the basic yearly physicals. Tell me why that is so important.
Yes, so again, in overall medicine, early detection, prevention, those are the key instruments that we have for better outcomes. So if we have any excuse to go see your physician, your healthcare provider, and get a well-checked, get everything set up and make sure that everything is in order, I don't see why we wouldn't take that opportunity.
No excuses, just do it. Thank you so much, Doctor. Great to see you today on the show. If you would like more information or to make an appointment with the Penn State Health Urology team, call 717-265-8585. Welcome back. Joining us again is Dr. Raman and Rory Ritrievi. I want to point out the QR code here at the bottom of your screen because you can make your donations to No Shave November right now. People are donating right here during the show, so thank you to everybody who's done that. And again, it's 10 years now, and this is a big milestone. And Dr. Raman, when you think back to the first time you did this, like what really stands out to you about this campaign?
Yeah, I would say how much it's grown. I mean, 2016 was the first year. It was led by Mid Penn Bank. It actually was only from Mid Penn Bank, Rory, Dawn Spar, and they reached out and they wanted to donate some of the money they raised, and we really needed some help to get some of our research mission off the ground. The next year after that, our team was able to partner with their team, and even though our two institutions continue to sort of lead the way, now we have all these community partners. I think last year was over 900 people contributed.
Wow.
So to me, that's what it's all about, right? It's not just Mid Penn Bank, it's not just Penn State Health. It's actually so many people contributing to this effort.
Yeah, I mean, this is a strong partnership, right? And you keep bringing more and more people, more community partners on board. What makes the partnership to you so special?
Yeah, just like I think that it's the relationships we build in our personal lives that make our lives special, I think the relationships we've built over the 10 years of this partnership have made it special and lasting. And that's not just the relationship between us. Now, clearly we like each other a lot. And we didn't know each other 10 years ago.
We did not.
Yeah.
But it's the relationships between the doctors and the employees of Mid Penn and the relationship with WHTM. and good APA. And you guys have been a real differentiator for us.
It is fun having you. It is really fun having you. And the campaign, as we know, it's more about way more than growing beards. You know, it is growing awareness and donations. So any final predictions or anything you want to say to really push those donations?
He's the banker, so I'm looking
Money guy.
at him.
Yeah, I will predict one thing: fun. I think we're gonna have a lot of fun this month. We already did with the kickoff party. I know we will at the mid-month party. I know we will at the Dash for the Stash, which I know you're going to probably run.
I will run.
I will be far behind you. So if you could be at the finish line with maybe some hydration for me. So I think that we're going to have a lot of fun, and I think we're going to raise a lot of money, and I almost guarantee you we'll hit the 350 or better.
Yeah, 350 or better, or 10 million, right?
I keep hoping.
I'm not predicting it, but I'm encouraging it.
If that 10 million comes in, just who does it go to? Does it go to you or does it go to me? I mean, we're like pretty close.
Matter. It doesn't matter.
Give it to you. If it comes in, it'll be. You can say that's yours.
I think we give it to Amy because she's the one who called for it. So
kudos to me. Okay, thank you guys. Good to have you back on the show.
Thank you as always.
If you would like to donate to No Shave November, scan that QR code on your screen right now. We'll be right back. If you would like more information or to make an appointment with the Penn State Health Urology team, call 717-265-8585. If you'd like to register for Penn State Health's free prostate cancer screening, the information is right there on your screen. The screening is open to men 50 and older. And this reminder, Mid Penn Bank is hosting their Dash for the Stash 5K Run, Walk, and Fun Run on Saturday, November 22nd. The information is on your screen, and you can scan that QR code to register.